Hi, everyone, and welcome to Procure Pulse, the third-party services podcast that provides you with current trends, best practices, and the latest supply chain news to help you stay informed. I'm Mickey Meehan, your host today. I invite you to email us with questions at info@conductiv.com or connect with us on LinkedIn by following Conductiv or on Twitter at Conductiv Inc. Thanks so much for joining us today. Let's get started.
Hey, listeners. After a little hiatus, Procurement Pulse is back. Conductiv has had a lot of exciting things going on. I've taken over as group vice president of the organization. We published a book, Significant Figures, and we finished a successful trade show circuit this summer and saw a lot of you. Most recently, Megan and I were part of a lunch and learn session at IDN to discuss factors that affect purchase services success. And so we wanted to bring Megan back today, our Senior Director of Strategic Sourcing, to dive a little deeper into some of those factors and some of the trends we heard from audience members while we were at IDN as well. So I'd like to introduce Megan Shull. Megan, it'd be great if you just gave the audience a little bit of a background of where you've worked and kind of how you ended up here at Conductiv and your journey in purchase services.
Yeah, absolutely. Thank you. I'm really excited to be here with you guys and share a little bit about kind of where I've come from and what I've seen in the industry. I have been doing purchase services for about 12 or 13 years, so maybe before it was cool or people were really into it. I manage a team here at Conductiv of sourcing managers who are dedicated to our members, so looking at opportunities within IDNs and hospitals across the country. Prior to being with Conductiv and Premier, I was with a nameless GPO. So I have had both that GPO and purchase service hat for quite some time.
That's awesome. Yeah, and I know, you've been embedded in health systems before. Right now you help health systems with sourcing and purchase services. So you kind of have really good, diverse set of experience that I think our listeners can really learn a lot from. I think, as we were at IDN, we talked to a lot of industry experts and supply chain leaders, and, all had varying levels of sourcing sophistication. From your perspective, what were some of the biggest pain points that experts, leaders shared at IDN that, really, where's the biggest pain points that they're having right now within this last year?
Yeah, definitely. There's kind of two things that I think always pop out to me when I'm talking with hospitals and IDNs more than anything else. Really, the biggest one is that they're not able to easily access their contracts and their data related to purchase services. It's not as simple as when you're looking at med search type items and you can pull a report showing a listing of everything you bought and the individual prices you paid for each item. It's much more complicated. And often the pricing is not clear when you look at an invoice. Perhaps you're paying a flat monthly rate, or you're paying some sort of rate that's loaded with a upcharge or something else. So it can be really difficult to understand what you're looking at in terms of data. And for the contracts piece, they're often not centralized. So maybe they collected the contracts and put together some sort of repository for them. But oftentimes I find they're still just not all there. Many of the contracts are still in people's desk drawers. Amendments are not kept with the contract if the contract was filed. Even if they do a great job of putting them all together, they don't have the ability to easily look at the contract and have a process set up to determine what to do with them. Oftentimes, I know when I was an embedded resource, we would be looking at something 30 or 60 days before expiration, which really doesn't leave time to do anything besides extend it or maybe try to ask for a pricing decrease quickly if you really need to do that. But it just doesn't allow you to proactively look at a contract and consider whether or not an RFP or taking something out to market is the best strategy. So coming up with a plan to look at those contracts and that data further in advance, I think is a big piece to having that visibility. The second thing that I kind of hear a lot is the lack of benchmarking. So even if you've got all your ducks in a row and you can see what you're spending and you've figured all that out and you've dug into it, you don't know if that price is any good. You don't know how it compares to anything except maybe the last year of your contract, the last time you renewed. Maybe you have visibility to like one of your neighboring hospitals' prices, but you really don't know compared to market, how your pricing is doing and whether or not the supplier is giving you the best pricing or the most appropriate pricing for the services that you're getting. When I tell people about our benchmarking capabilities and our precision benchmarking reports, they're often really excited and kind of floored that that's even available in the purchase service space. I know when I joined this team, it was really exciting to me because I had probably spent about 8 years sourcing for purchase services without any benchmarking. And it's really flying in the dark and kind of by the seat of your pants to figure out if you should push or not push. And you often end up RFPing way more than you should need to because you just don't know what the market has. And so you're trying to compare via RFP rather than doing something as simple as a benchmark that you can get done in a couple weeks and know what you should do with your project. So I think really having access to something like the Conductiv benchmarking to review those purchase services can be huge to overcoming that barrier.
Absolutely agree in everything you just said. I would say one thing I'd love to dive into just a little deeper. You mentioned the benchmarking in services, and I people know benchmarking from widgets. They're able to easily benchmark those prices against their peers in the market. But can you talk a little bit about the complexity of doing benchmarks in services and why people aren't even aware that it's available?
Yeah, absolutely. I think that one of the hard parts of benchmarking in services is people think you can just say, for example, in EVS, well, how much am I paying for a cleaning person per hour? You could certainly do that, but it's not a widget to your point, and that really isn't going to provide you the benchmark that you need. What we do is take a look at the bigger picture. So how many staff do you have locked in to certain areas of the facility that are providing dedicated services? What kind of white glove services do you have? Are they doing something different maybe in your labor and delivery than they're doing in other areas? Taking a look at the exact services that are being performed in addition to the price that you're getting on an invoice lets us look better at whether or not that pricing is accurate. If you're expecting a lot of white glove service or need a lot of white glove service and have a lot of dedicated locked in resources, you're probably going to be paying a little bit higher price, and the price that you're paying may be justified. Rather than some benchmarking tools that'll literally just say, we see in the market, $12 to $15 an hour for this type of person. If you're paying more than that, it's too much. That's not really going to tell you what you're doing. You have to get to that granular level of how you're utilizing those services within your facility. So one of the things that we'll do when we do benchmarking is not only do we ask for the contracts and the data reports, but we're going to ask you some of those uniquenesses of that particular service to make sure that we're capturing all that when we kind of benchmark and tell you what we think the pricing should be.
Yeah, that's a great point. I mean, and I think, it's still something that's on the rise. I mean, we obviously have been doing benchmarks like these for a long time, but we're ever increasing the number that we have available, to fill the kind of expansive purchase service area. And innovation in the space is really fun right now since hospitals have a lot of focus on purchase services. Kind of moving on, one of the things that I thought was really cool from our session was using Slido for the live polling. I thought it was just a lot of fun to kind of see the responses come in real time, and I think everybody encouraged each other to respond and then see everything up on the screen. But from that, what were some of the focus areas for developing their sourcing strategies and their purchase service programs deeper, that you heard from the audience?
Yeah, I loved the Slido tool as well. I think it really gave the audience the ability to participate and feel like they were part of what we were talking about. Through the question and answer and kind of, in addition to the Slidos, I really felt like supplier performance management, stakeholder credibility, and then technology kind of stood out as the three areas that they seemed the most excited about or the most interested in developing. They discussed needing to develop trackable KPIs. So while some of them may have KPIs in their contracts, they didn't necessarily have things that were measurable or could hold the supplier accountable. So having those sort of penalties or sometimes incentives in place to keep the suppliers engaged was something they spoke a lot about. I think another kind of barrier or challenge they talked about in developing that is even if they did have KPIs, they didn't have a central location to check on and track and measure the KPIs. So they were excited about the possibility of developing something along those lines, either through partnership with Conductiv or looking at it on their own, how they might track those better. Because once you've written them, that's great, but how are you tracking those and making sure that they're happening? They really kind of wanted to focus on that and develop it as they became more advanced. I think those that are farther along the path are looking at the way to track it, and those that are early on are just trying to get the KPIs even in there so they can manage what's going on and hold those suppliers accountable. The group also discussed kind of having difficulties engaging stakeholders in other departments. I heard a lot of kind of dialogue in this in the Q&A afterwards. The forming relationships with HR and with IT and with finance were hard, but they really are critical in having success in purchase services because a lot of your contracts do live in those other spaces. They don't necessarily live in the centralized, supply chain space. So partnering with those groups and figuring out how to have success there, I think is something that folks really want to focus on over the next couple of years. I do know one kind of little fun idea that I offered the group to get this moving is I've found with ours that sometimes picking something they don't care so much about and kind of letting them let you run with that. So say, hey, for example, in the finance space, can I look at your bad debt agreements? Like bad debts, it's important to them. They're collecting on it, but it's not a big service satisfier. Like they can tell really easily whether or not they're doing it. They don't necessarily care as much about the relationships. Offering something category like that, like let me just take this one little tiny piece of all your collections and just look at bad debt for you, see what we can find, and kind of build your credibility that way, so that when you're done and they're really happy with the project, they want to engage you and do more with you.
I love that. I love that. And I think, I mean, one of the things though that stands out from what you just said there is that people are really important. Because there's a lot of interfacing between different groups and building relationships. So like, what kinds of staff and skill sets are necessary to really make a program in purchase services successful in your mind?
I completely agree with you. I think relationship is one of the key pieces of sourcing. I view our role as, sourcing managers with the Conductiv team as relationship builders. You have to be building strong relationships with your suppliers and with your stakeholders and developing partnerships. You The old ways of going in and hard negotiating the pennies out of your suppliers doesn't work with purchase services. You're relying on these people for something more than just providing you a widget. Their staff are coming into their facilities, they're face to facing with you, and having a good, strong relationship and partnership with them, I think is key. So, as you're negotiating contract terms, coming to the table with all of the background information on the category. So, looking at your benchmarking, looking at your contract, kind of knowing the market overview in general, and saying to them, this is what I'm seeing and this is what I think our pricing should be based on, that is going to get you so much further along the line with the suppliers. And laying out those clear KPIs so that they feel like they're involved and engaged, but they're not, you know, they're not involved and engaged, but they're not being pushed into something they can't achieve. If you're wanting, I don't, maybe a 99% on time rate for a service and they're saying to you, well, we could give a 97 and then agree to a penalty afterwards. Talk through that. Maybe you don't need to be hardline on that. And 97% of the time, when you look at the 300 times they're coming there in the year, is a really great rate. So I think really taking into account and working together to develop what those KPIs are going to be, and what that partnership is going to look like is huge. You have to have the partnership from your stakeholders that are using the services and from your suppliers.
I love the word partner. I think, one thing that came from the pandemic is that health systems and suppliers really need to partner and support each other to make sure that that both are able to grow and support their organizations and ultimately deliver amazing care to patients, and that neither side can make that happen without each other. And so I do think that there needs to be a much more successful or a much greater goal of focusing on those partnerships, especially with your key strategic suppliers, and make sure that you're really, really tight. Another interesting thing you said there, is focusing on the relationship building piece, and that means the relationship between, the sourcing staff member and the stakeholder. So, how involved do stakeholders need to be in the sourcing process versus the supply chain team, and how do you think organizations can be successful there?
So I think that a, a common misstep of organizations that are still kind of in that legacy developing phase is to not include their stakeholders early on. It's really absolutely critical that stakeholders are included at the beginning and throughout the sourcing process. They need to be engaged at the project kickoff so they can help you define what's in scope, what's out of scope, if there's certain services that are that white glove level that need to be included. They provide all that key information on the day-to-day operations of the organization that the supply chain team may just not have visibility to, or may not know exactly what questions to ask, because supply chain cannot be an expert in every category. They work so many different categories in purchase services. They really need to lean on those stakeholders to be their subject matter experts. The stakeholders should be helping weigh in on the RFP questions, add to them, tweak them, and also have a say in the final vendor selection. Each IDN or hospital is going to do that final vendor selection different. If you do like weighted scorecards, they should certainly be included in the scoring process. If it's more casual discussion, be a participant in the room so that they can provide their concerns and feedback on the different presentations. Really, without the stakeholder involvement, supply chain could make a decision and adoption could simply never happen. If they're not fully on board and fully understand what's going on, people will go rogue and contract without you, or just not stop buying from the person that you told them to. You really have to kind of make sure that they understand and embrace any decisions that are made and feel like they were a part of the process.
Yeah, that's great advice. I mean, I think there's a lot of being a politician involved in working in the supply chain
Yes.
department, just in the fact that you really got to bring people together, which is not easy. But when you kind of mash the idea of bringing the stakeholder together with the sourcing team, and then you bring in the partnership related to suppliers, like, how does sourcing impact supplier performance ultimately at the end of the day?
So it hugely impacts it. When you're laying out that agreement up front and you go through the RFP, I really recommend including the key performance indicators you're looking for in the RFP. Flat out ask for them up front, tell them what you're expecting for them to achieve. Certainly be open to feedback from those suppliers, what they might tweak or do differently, but have those KPIs and the fact that you're expecting a certain level of expectations set up in the RFP process. And then when you write that agreement, you're going to write the contract to include all those metrics to hold them accountable to that high standard of excellence that you asked for in the RFP. A lot of times I see a really great RFP done by supply chain and not all of those terms carry over into the RFP. So taking the time, or the contract. So taking the time to make sure that everything has carried over into the contract is critical to success. You have to make sure that you have either penalties or incentives assigned to each of those indicators to incentivize them to maintain that quality level throughout the 3, 5, 10 years that you sign the agreement for. So really look at how you want to structure the deal. Is it if they don't meet the metric of showing up on time 97% of the time, there's a invoice credit of a certain amount? Or do you look at it the other way? I've seen a lot of interesting incentives now where it's if they achieve the 97% or greater, then the member or the IDN or hospital will give some sort of incentive back to them, maybe increased hours used or increased service needs, even pay a slightly higher rate if they're receiving those HCAP scores that they want. So get creative about how you hold them accountable. It can be a penalty or an incentive, but make sure that you are including those in the contract itself so that you have that to hold them as accountable. And when those aren't achieved, you have clear outline for breach, if for some reason you do need that.
Love it. Love it. Now, the one thing I think, and this is probably leads us to our last question here is, you're talking about tracking supplier performance and penalties. You're talking about a lot of collaboration between stakeholders and sourcing. What's the opportunity for tech enablement in purchase service sourcing success in 2023?
I think tech enablement is going to be huge. I love tech and purchase services. I've kind of always been like, how can we automate things to make our jobs easier? It's not about replacing all of us in supply chain and sourcing, but really about how can we make our jobs easier. And a lot of the tools that Conductiv has developed and that I see in the marketplace around tracking your KPIs, so creating that one-stop shop where you can load KPIs or find KPIs to be able to develop that with suppliers is huge. Looking at supplier diversity has exploded over the last couple years. But how do you know that a supplier is qualified in those diverse areas? Another place where technology can help you out, having a supplier diversity module where you can log in and look at different suppliers. Maybe you're trying to focus on laundry and you want to see which vendors might fit that diversity piece for you also. You can get in and search around for those things, or just tracking what you're even doing in diversity. How many diverse suppliers am I even utilizing? I think technology is going to be the only way we kind of survive this purchase service explosion. There's so many different contracts and so much money spent in purchase services that I don't think that the sourcing folks that we have in supply chain can possibly manage it all by themselves. We're going to have to employ good technology to empower people to track those items and to get the information they need to make those great partnerships with suppliers.
Totally agree. And I think, obviously we at Conductiv are extremely passionate about figuring out how to help make that happen and how to really be on the forefront from the automation of purchase service sourcing standpoint. Megan, thanks so much for coming on today and chatting. It was great to hear about your experience at IDN, and it sounds like it was a great experience. I know you and the team have some exciting things in the works for the next year, so hopefully you won't mind joining us again at some point on here to share those insights with everybody else.
Yeah, I'd be happy to. We definitely have some cool projects going on that would be great to share.
Awesome. I'd also like to thank our listeners. If you missed us at IDN or at ARM this summer, please always, you can always reach out via our website, get in touch with someone to check out some of that sourcing automation technology and analytics and some more of our capabilities here at Conductiv and how we can help your organization in purchase service sourcing. Thanks, everyone, and we look forward to seeing you back here at the next Procure Pulse coming up soon.